Remember how thin Tom Hanks got for the movie Castaway? He apparently had to lose around 55 pounds for this movie role. And now the actor says his dramatic weight loss and gains for movie roles maybe has to end because it could have had something to do with his type 2 diabetes diagnosis.
But for the rest of us whose weight may go up and down a few pounds, we wondered, when should we be worried about the disease? In today's Doc Hollywood, we sit down with a family medicine physician at HealthPartners clinics to find out and talk about other celebrity health news. Take a look. I'm here with Dr. Joe Kalugdan, a family medicine physician at HealthPartners Clinics. Nice to see you, Doc.
Oh, thanks for having me here.
Well, I'm really excited that you're here because we wanted to talk about this Tom Hanks story. This has been big over the last few days, and he revealed that he's been diagnosed with type 2 diabetes. You know, he's known for those weight swings when he does these roles. Remember when he lost so much weight for Castaway? He put on 30 pounds for his role in A League of Their Own. Talk a little bit about that weight going up and down. Can that contribute to type 2 diabetes?
First, let's start with the difference of the types of diabetes. There is type 1 diabetes, where basically the cells inside your pancreas is unable to produce insulin. Now, the actual cause is more of an autoimmune cause that's making it a little bit difficult for patients to produce the insulin that's needed for their body.
Okay, and type 2, that lifestyle is important.
Yeah, so what happens is when you increase your weight a little bit, it causes you to have a little bit of resistance. So even though your pancreas is putting out a lot of insulin, it's still not being effective enough to get rid of the sugar.
Okay, what about the rest of us who maybe aren't fluctuating 30 pounds, 50 pounds, but maybe like the 10 pounds? Maybe I'm speaking from experience here. Can that up and down 10 pounds cause a problem?
By losing the 10 pounds, it could definitely make a big difference in controlling your blood sugars.
Moving on to Tom Hanks' co-star in Splash, Daryl Hannah. You know, we haven't seen much of her lately, but she did reveal that she was diagnosed with having autism as a child. She's 52 years old now, and we really didn't know that much about autism, particularly with her way back then.
With autism, it's actually a spectrum disorder, and so there's quite a bigger range of symptoms that can be found with a child with autism. There are 3 common features that occurred. One is a little bit of a delay in their social interaction. The other one could be a little bit of a delay with their language production. And the third one is that sometimes they exhibit unique behaviors that we normally would not see in a person interacting with in a conversation.
So if you're a parent and you have a child and maybe you have a concern, is it important to get that child in to see a doctor?
Yes, definitely. We have several tools, screening tools, to look for while we see your child. And definitely these are kind of features that we would notice to make us think a little bit more so that we can get them to the right specialist.
Drew Barrymore from the movie Big Miracle, she has a little baby girl, Olive, just turned 1. Now she's talking about getting preggo again. She wants to have another baby. So Doc, how soon is too soon to have another baby?
Well, having the choice of having your 2nd, 3rd, or even 4th child is definitely a personal choice. We would recommend that we definitely want you to space out your pregnancy to at least a year if possible. The reasons for that is that you want to make sure that the changes that are associated with pregnancy are able to recover, which can increase your risk if you have them spaced a little bit too closely.
Thank you so much for your time, Dr. Kalugdan. Appreciate it.
Thank you. Appreciate it too.